Hello, Don here. Welcome to Podiatry Practice Mastery, where we're helping you bring your practice to the $2 million mark and beyond. So I'm going to give my update based on some of these practice audits. I talked a little bit ago about offering a few practice audits that I was going to do, kind of pro bono, both so I can get practice and give people a lot of value, and I can kind of see how they're going. So I have currently got 4 people that filled out my practice audit. Now, it takes a little bit of time, it takes 15 or 20 minutes. For a few of these, I had to add some clarifying questions, so I think it's good to do some of these audits because if I have to ask a clarifying question a lot, I need to add that question to the audit. So I don't want to make it too long, but I really need a good sense of what the practice is producing so I can kind of give some recommendations. So I'm going to go do high level based on these first 4 audits. And once again, if you're interested in doing these audits, there might be a few more I'm doing for free. Otherwise, I'm basically going to start at a certain price, then I'll just keep increasing the price depending on the demand, because if there's too much demand, I'm not going to have any time to do them all because it takes me a while to do them. So if you go to podiatrypracticemastery.com/audit, you could certainly do it if there's any space left for these free ones. Otherwise, you just pay me a little bit of money. Only, I think, and I guarantee you're going to get probably 10 times worth what it costs you. Otherwise, I'll give you your money back. That's fine. Okay, so the high level is that these practices that were doing the audit, the first one was a gentleman. He's been in practice about 40 years, and he's kind of towards retirement. And when I was looking at his numbers, in terms of the real telltale sign is how much he's taking in each month, and then how many patients he is seeing. So the whole problem for the first practice is that he wasn't seeing enough patients. And he said some curious things in the audit, like he doesn't like to see patients that have been seen by ortho or any other podiatrists, and he doesn't really do any advertising or anything like that. So I don't just do the audit. What I do is I also look, like I Google whatever podiatrist in Worcester where I'm at, or a podiatrist in whatever city he's at, and I look at his Facebook, I looked at his Instagram if there is one, I looked at the amount of reviews that he has, and things like that. And the whole issue is he would like to get to the $1 million mark. He's actually under the $500,000 mark, and the reason is he doesn't have enough patients. He doesn't have enough patients in the door. He's not seeing enough patients, and he feels like the amount of patients is going down. So I learned this from Alex Hormozi. You either have a practice that is demand constraint or supply constrained. Okay? So if there is not enough demand, okay, your only focus is fixing demand. Okay? If you are supply constrained, there's not enough supply. There's not enough of you to go around. There's too many patients, and then you can increase prices. But when your whole focus is not seeing enough patients, so he is working full time, but he's only seeing like 150 to 200 patients a month, and the whole problem, he's not seeing enough patients. The problem isn't that the patients aren't valuable enough. When he's seeing patients, he is producing a lot of revenue. There might be more surgical patients here, but he doesn't have enough patients in general, this first doctor. And so when your problem is not having enough patients, all your focus goes on getting more patients. That's it. So getting patients to come back more, getting more patients to refer other patients, and then having whatever your referral sources are to get more patients. Okay, so let's say his per visit value is high. So let's say it's 150 to 200 per visit, but he's not seeing enough patients. He'll never get to the $1 million mark. Okay, and then you can't just complain. So what you do is you Google your name, you Google where you live, where you're a podiatrist, and you compare the Google reviews. And that's all I did. So he has about 40 reviews, and then the other doctor that shows up has like 1.2, like 1,200 reviews. So in a simple cursory glance, the reason they're going to the other clinic is they have 1,200 reviews and he only has 40. Okay, and so when people are Googling, they're going to go to the other doctor. So my first recommendation, the simplest recommendation, is develop a system to automatically request reviews. There are a number of systems out there. The one I currently used is called Swell. It's only a couple, I think it's $200-300 a month, and every patient that comes in, it will ask them to give a review. There are some other cheaper ways. You can give them like a card and ask them to do it, but I find the automated system works well, and we pretty consistently get about 10 to 15% reviews. So if he's seeing 20 patients or 200 patients per month, he'll get about 20 reviews, and it'll slowly add up. Now, this is a slow process, so a couple of other options. If he has an email list, he could ask all of the patients to give a review online. Okay, so every single patient that comes in, he could ask them to do this, and this would be beneficial for his practice. He could send out an email to all the patients, say, hey, would you please give me a review online? Like, all these things are going to be beneficial for his practice. Okay, that would really, if he, but to get from like 40 to like that is going to take a long time. Like if you're adding 20 a month, it's a really long time. So I think an easier way is to ask every single patient, even maybe give them, I know you're not supposed to give an incentive, but have them do it right when they're office. You really have to develop a way of doing that. But you have to start the process. Regardless, you have to start the process, and those are a few options. Okay, the other option in terms of getting more patients is he could go and visit other referring doctors and kind of see, well, why are these doctors not referring? Get them to refer more, so you could set up referral, things like that. Another option is you could kind of have a focus on urgent care. This is something that I've done to get more urgent care patients in. You could put a web page for urgent care and then do AdWords. And so those are kind of the low-hanging fruit for him. And then the other thing I would say is, if you need the patients and you're at $200 per visit, you can pay for them. So you could figure out how to do AdWords and just have patients come in based on these AdWords, Google ads or Facebook ads or whatever type of ads you're doing. You really have to get these patients to come in. So if your problem isn't money issue, it's not how much you're getting per patient. Really the issue is you don't have enough patients. So this is that first doctor. Hopefully he'll take my suggestions. The second doctor has a very solid practice. He is working, I think, 3.5 days, half day for admin. He has about $200 per visit, so he is already producing quite a bit. He is some months he's at 90,000 collections, other months he is at like 60 or 50,000. So there's a lot of variability in this practice. He does some MIS surgery, which makes the amount that he brings in a little bit higher. He really wants to hire another doctor, and he is producing some months seeing a lot of patients. So I find there's a lot of variation with this other doctor, and he is younger, he does MIS, he does a lot of things right. The variability comes in, like some months he has a good per visit value, and other months it's a very poor per visit value. And I'm not sure if that's just like maybe billing and how things kind of get messed up in terms of collecting more at the end of the year or certain months. My main recommendation for him, because he already has a solid practice, would be if he's able, once he is totally busy, like let's say 25 patients a day or 30 or whatever he wants to do, because he's already profitable, the only next step would be to hire another doctor. So I think that would be his next step, would be hiring another doctor, finding a doctor. Now this other doctor I just talked about, that came to visit me from New Hampshire, he has a hard thing. It's hard finding doctors. It's hard finding doctors that want to work. And this other doctor is having the same issue. But let me just put it out this way. Let's say you have a doctor that, let's say they don't produce a lot. Let's say they're producing $600,000 for you. Okay, so if you pay them 30%, okay, you're gonna pay them $180,000. And if the overhead doesn't increase that much, you are able to pay them. You have a lot of left over. So I would be willing to pay, like in 1 year, $20,000, $30,000, even $40,000 to find this doctor, whether it be giving the doctor a bonus or whether it is you're using a headhunter. Okay, so if you really need to find a doctor, you think about it. It's more of an investment, and you should be willing to pay quite a bit. Now, they're not going to be producing maybe $600,000 the first year, but if you have a lot of pent-up demand, like this other doctor in New Hampshire, I'm not sure about this other one that I'm reviewing his practice, but if there's a lot of pent-up demand, you can definitely spend $10,000, $20,000, or whatever it might be to find a headhunter to find this patient for you. I think it's something that is really, really beneficial, okay, for your practice. Okay, so that's what I would recommend him. The other thing I think that's low-hanging fruit is this doctor does not have Shockwave, and I really think with a practice that's surgical, he's doing, like he said, MIS in the office, doing Shockwave for a lot of these tendinopathies. This will be low-hanging fruit for him because he's already doing amnio. Okay, so developing packages for Shockwave. I do not. I do some little MIS. He does bigger MIS than I do, but from what I hear from the MIS people, or even from the people that do a lot of surgery, is that a lot of it isn't in the surgery itself, because you can bill, let's say you don't bill for like a facility fee, you just get the bunionectomy or whatever. A lot of the revenue comes from the ancillaries. So what I mean by that is you may consider something to help with bone healing, like an EBM bone product. It might come from laser therapy to help with swelling after. It might come from doing Shockwave either pre or post for surgery. So these types of things are gonna help your practice. Okay, so just kind of a word to the wise for surgery. A lot of it is not the surgery itself; it's a lot of the ancillaries that you can use staff to do. So that was the second audit that I did. The third audit was another doctor. She's here. She's in the Cape area in Massachusetts, and she bought an established practice from another doctor, and she is quite busy. Problem with the Cape Cod, as you know, or maybe you don't know, a lot of people in the winter. I'm sorry, not many people in the winter, and a lot of people in the summer. And she has a high percentage, since so many people retire in the Cape, a lot of old people with a CNC type of a practice. She was not totally up to like her numbers in terms of she wasn't seeing a ton of patients, so she needed to see more patients. It's kind of cyclical, and a lot of routine in this practice. So the number one thing for her, I don't think it's going to be patients, because there is a lot of patients in the Cape area, and these patients tend to have a lot of money, which is a benefit for anyone. You want to work with people with money. And one thing that she did that was very smart is she has Softwave, and so she's been offering Softwave or Shockwave for her patients, and she charges a premium. I think it's $300 a treatment, and I think she's probably doing 3 to 6 treatments. So, and they're not balking on that. So I think number one would be to kind of focus on that on your website, on the patients you're treating. Once again, I'm a big advocate of, there's 2 approaches I find that work best for routine care. One is to do like a half day or a full day a week, and that's it. And the other days you're seeing normal patients. And the other option is interspersing it, doing a couple an hour, and then intersperse them other patients, or having like a nail tech do them, or a nurse do them. I think those are things that work well in practice. So she is. And then the whole like influx of people in the summertime, I think you have to capitalize on that. I would even think potentially in the summer you could put more ads out and see these people that are vacationing. They tend to be not as price sensitive for these things, and just kind of offer a lot of treatments and putting ads in the summertime for this patient, for this doctor. In terms of the Google search for the Cape, what was funny is that there's a sponsored ad for the Cape, so someone is paying for AdWords, which wasn't her practice. And then mine was second. So I'm in Massachusetts. Mine was second, and the problem is her office only had like, I don't know, 100 reviews, and mine had like 1,200 views. So a lot of people I'm getting coming from the Cape. So I told her, you should do either Swell or do something to boost up your reviews. They'll stop coming to see me, and that's fine, because it's too far of a drive. But so many people are coming because of the amount of reviews that I have. And I'm not that much better, I don't think. I just have a system for capturing reviews, and I've been doing this for years. So it does take time to do this. A couple of other things she doesn't have. She doesn't have an email list, and she's not sending out an email to her patients. And then the last thing I think would be, in terms of her routine care, once she puts it all in one day, she can increase the amount that she's charging for self-pay care or routine care, because they all have money in the Cape. So there's a lot of people that have money, and especially in the summertime when so many people are vacationing in the Cape, she can produce a lot of revenue. Okay, so those were the main 3 audits that I did. Those are kind of my recommendations. So the nice thing about the audit is when I look at the revenue, I can see the revenue, I can see the number of patients, and then based on that I can see, do they need more patients or do they need to produce more per patient? I do a better job at helping practices when they're already full. Like, to get a practice full is kind of a challenge. It takes a certain amount of time. It takes a lot of marketing to get that built up. Or you have to pay a lot in AdWords to fill that up, and I do think it's worth it. But I find I do a little bit better when doctors are already seeing like 25 patients a day, and then they want to be more profitable. That's where I feel like I can really help you to produce more, putting together different types of packages. And so if you want to do an audit, let me know. What I do when you fill out the audit is I go through it. I mark up I make it printed out as a PDF so I can go through it. I print out and I put little marks in there. I'll give you that PDF. I also look at your online presence, and then I'll record a video and I'll give that back to you. So I'll record kind of what's working, what's not working, and different types of changes that you can make. I think just by doing the audit, frankly, it's gonna spark your, I don't know, interest if you have any type of, how do you say it? If you're aware of what's available, the way I word the questions, and if you see you're not doing a lot of the things that I'm recommending, like just by taking the audit and saying, okay, well, Don is asking if I'm doing this, I'm not doing it, well, maybe adding these things would help my practice. So I think one of the challenges, and I think this is why I like the audit, is when doctors do it, it sparks their interest. But I think where people struggle with is implementing it. So if you take the audit, you can look at all my recommendations, but then you need a real simple plan of implementing it and taking it one step at a time. I think sometimes we get really overwhelmed about having too many options of things to do in our practice. And I've struggled with this because the problem isn't the too many ideas. The problem is you're already seeing a full patient load. You are already having your family obligations, you're already doing all these other things, and then all of a sudden Don gives you this audit and there's like a ton of things to do, or a ton of suggestions. So, and you don't have any time to do it. And I think one of the keys for the smarter doctors is setting aside time, like buffer time, and taking one thing at a time and fixing it. Okay, and once that's fixed, then you go on to the next thing. If you have too many things, you're not going to do anything. And I keep it real simple. This is the way I think about it. Is if you don't have enough patients, your only focus is on getting more patients. Okay, so if you're not seeing 25 a day, if you're not seeing, 125 per week or 100 per week, which would be about 400 per month, 3 to 400 per month, your only focus is getting that number up. That's it. You're not going to try to earn more. I just find like if you're trying to do too many things in the practice, you're going to get overwhelmed. So if you don't have enough supply, you need to focus all your resources on getting that supply up. And that is the most challenging part, I feel. And we have to constantly be working on the supply. And you can either get it from your current patients, getting them to come back. You can get new patients from other referral sources or online from your reviews usually these days. Or you can pay ads and learn how to do ads. I want to be clear. I haven't broken or I've figured out this whole ad thing yet of how to use it to drum up patients. Because as I'm doing my results and as I'm looking at it, like all of mine are coming from my SEO for my website and online reviews. That's where all my patients are coming from and doctor referrals and things like that. The ads aren't really generating a huge amount of my patient flow at this point, either because I'm bad at the ads, could be that, or because I'm not spending enough on ads. So I feel like you have to be willing to invest. But I want to go back and just talk about like this one thought. Remember what I said about if you have a lot of pent-up demand, you can put another doctor, and that other doctor is going to, let's say, produce $500,000 or $600,000 for you in collections, and you pay them 30% of that, okay, or whatever percentage. There's going to be a lot of leftover. So I think the idea, if ads are set up right, and you're spending money on ads, and you're still profitable, meaning if your per visit value is like $200, and let's say for each patient it's worth $200, and you're spending, let's say, $2,000 per month, but you're getting like 10 patients, it's gonna pay itself off because they're gonna keep coming back. into your practice. I think that's the area that I feel like I'm focusing on next, and how to crack that egg and be comfortable with spending $2,000, $3,000, $4,000 and be comfortable getting those patients in. Okay, because a lot of times we feel like we're kind of focusing on one area and we're too narrow. Okay, I'm going to only do SEO, or I'm only going to do Google reviews, or I'm only going to do requesting reviews and all the things like that. People aren't willing to go into the ads, and I think a lot of it, for me, for me is that I'm not comfortable doing the ads, and I'm not confident in saying, okay, this is my ROI based on the ads. I'm getting these patients, because if I knew like each patient that came in would be a plantar fasciitis patient, and I could do my best package, it would be worth it all day long just to specifically focus on those types of patients. Anyway, if you are interested in doing an audit, go to podiatrypracticemastery.com/audit, and there might be some space. If not, you pay me money. It's very low for what I would give you in my time making this audit for you. And then for certain ones, if you're like, hey, I need help implementing this, I do help this for a few practices that need help implementing this, because sometimes it's just a little overwhelming. Okay, talk to you soon.